Hey guys, welcome to our Billing English. In this video, you are going to learn about what is DX code, CPT code, modifier, place of service, and revenue code. Before that, if you haven't subscribed my channel our Billing English, please do subscribe it. And I have already made the same video in Tamil as well in our Billing Tamil channel. If you need it, kindly check in the description box. I have given the videos link. Without any delay, let's start the topic. I'm going to start with the DX code. DX code is also called as diagnosis code. It's a combination of letters and numbers that represents a certain medical conditions, symptoms or disease. Example, if a patient is corona positive, then provider will build the DX code as U07.1 in the claim form. U07.1 diagnosis code represent a COVID-19, that's a coronavirus. For each illness, there are different type of DX codes are available. In CMS 1500 claim form, that is a professional claim form, we will build the DX code in box number 21. And in UB04 claim form, that is in hospital billing claim form, we will build the DX code in box number 66. That's it about DX code. Now let's move to the next topic. That is, what is CPT codes? It's a medical procedure code. It's also known as current procedural terminology. That is the abbreviation of CPT code. It's a standardized alphanumeric code assigned to specific medical services or procedures provided by healthcare professionals. These codes serve as a universal language spoken amongst healthcare providers, insurance companies, and other stakeholders in the healthcare industry. Healthcare providers use CPT codes for procedures to document various services rendered during patient encounters, including diagnostic tests, surgical interventions, medical treatments, and other healthcare services. Each medical procedure code corresponds to a specific service and has a description outlining the procedure performed. There are currently over 10,000 CPT codes in medical terminology. However, this figure changes every year due to new codes being added and some codes being removed. Example, if a patient was taking a coronavirus test by the doctor, then the service was billed in the claim form as CPT code 87635. The CPT code 87635 represents coronavirus test. That's why it was billed in the claim form. In CMS 1500 claim form, in box number 24D, we will build the CPT code. And in UB04 claim form, CPT codes will be built in box number 44. That's it about CPT codes. Now let's move on to the next topic. What is modifier? Modifier indicate that a service or a procedure performed has been altered by some specific circumstance but not changed in its definition or code. They are used to add information or change the description of service to improve accuracy or specificity. It's a 2-digit code. It can also be numeric, alphabet, or alphanumeric. Example, if a patient has a stomach pain and he is consulting a doctor. Now, the doctor prescribed some medicine and patient left the hospital on the same day as the outpatient. Even after few hours, patient is getting heavy stomach pain again. Now the patient is consulting the same doctor and gets the treatment. Now we, the provider, will bill 2 different claims for patients each visit by adding the modifier, so that the second claim will not get denied as duplicate. The modifier 76 represents repeat procedure by same physician. Now as I said, the second claim will be built with the modifier 76. I hope you got an idea about this. In CMS 1500 claim form, we will build the modifier in box number 24D, and in hospital claim, modifier will be built in box number 44 next to the CPT code. Now let's move on to the next topic. What is POS? It is one of the key codes used in medical billing is the place of service code. This code indicates where the healthcare service was provided and is used to determine the appropriate reimbursement rate for the service. It's a 2-digit numeric code. Example, if a patient is getting service in home, then the place of service billed is 12. Place of service 12 means home health service. POS is built in only CMS 1500 claim form, that is professional claim. It's built in box number 24P. And now let's move on to the last topic. What is revenue code? Revenue codes are a standardized system that identifies any accommodation and specific service provided to patients in a healthcare setting. These services may include room and board, imaging services, medications, and more. Revenue codes are 3 or 4-digit number. In simple words, it represents where the service was rendered to the patient in the hospital. Example, if a patient gets service in ICU, then the provider will bill the revenue code 200 in the claim form. Because revenue code 200 represents service in ICU. It is billed in UB04 claim form in box number 42, and that's it about revenue code. Okay, now I'll explain all these 5 topics in a simple words so that you can remember it easily. DX code means diagnosis code. It is the code represents the patient's illness, only illness. And next one is CPT code. The abbreviation of CPT code is current procedural terminology. It means it represents only the service provided to the patient by the provider. It represents only the service. And next one is modifier. It means it gives an additional information about the service rendered. And next one is POS. The abbreviation of POS is place of service. It represents the place where the service was rendered, and it is billed only in the CMS 1500, that is professional claim. And the last one is revenue code. It represents the place where the service was rendered in the hospital. This is only billed in the hospital claim, that is UB04. I hope this video was helpful, and if you like this video, kindly do like, share and comment. If you haven't subscribed my channel, kindly do subscribe it for the upcoming videos. Thanks for watching.